The former Minister for Health and Aged Care, Greg Hunt, retired after the May election, but he's now using his knowledge and experience in the mental health space in a new role at the Turner Institute for Brain and Mental Health. Greg Hunt joins us live now. Greg, good to see you. Thank you for your time. Our viewers have seen you so much on their televisions over the years, and I think they're always interested to know how our leaders are going post-politics, what they do next. I know you've got a few things on the boil, but when it comes to this new philanthropic role, why the focus on mental health? Of all the positions you've no doubt been approached about, why have you gone with this one?
Yeah, no, nice to see you, Ash, and to everybody. It's good to be talking. Simple answer is, obviously, mental health is an immensely important issue for every Australian family. If we look at the figures, we know that 4 million Australians in any one year are impacted, that over the course of our lives, roughly half of Australians are directly impacted, and all of us are indirectly impacted, friends, family, if not ourselves, work colleagues. The Turner Institute at Monash is brilliantly led. Professor Kim Cornish, Professor Shantha Rajaratnam, a great team of 230 researchers and staff, but it's doing practical work on preventative mental health in the community in the southeast of Melbourne. So it brought a love of an area. It brought together my old electorate, covering not just Flinders, but the southeast of Melbourne, and then one of the great academic and research institutions giving practical clinical support as well as research work for patients. So it's a privilege to join them.
So, Greg, I was interested to read about this living lab study that Turner's doing. It sounds like a fascinating project. Just tell us a bit more about it.
So it's what's called a longitudinal study, which means it goes out over the course of the best part of a decade. It's focusing on 9 living labs, and these parallel the Headspace that people know, or the Commonwealth Head to Health, which has been established and which we're growing around the country. And it's about treatment for people in areas such as Frankston and Mornington, Pakenham, Cranbourne, and elsewhere. And it's helping them understand their challenges. Ultimately, the goal is preventive health, but it's also early diagnosis and treatment where that's necessary. And it's taking a long-term view of people through the 3 great stages of the Turner's focus of childhood and development, the adult years and the ageing years, and how people progress, particularly post-COVID, with their mental health, what interventions are working and what interventions are not necessarily working. And I think that's really important. And the fact that you have the academic rigour, the clinical support, but the outreach where the community can come and get that help, and that begins in 2023 in full, lasting over the course of a decade. That's just an immensely important, I think, Victorian, national, but even an international level contribution to understanding community mental health.
Greg, you've mentioned prevention a few times when it comes to brain conditions and mental health issues. So much is often said about treating those sort of issues, but do you think that's really the next frontier, that we really are just still learning so much about how to prevent these issues in the first place?
Yeah, so there are really 2 things that come together, and the title brain and mental health indicates that there's a neurological component for degenerative conditions. If you think of dementia and Alzheimer's or traumatic brain injury, as well as mental health, which can be derivative of the neurological or the actual functioning of the brain, or it can of and in itself be a challenge: anxiety and depression, bipolar, schizophrenia, and many other conditions. So prevention is about giving people the tools to understand that if they identify a problem early, it can be addressed, and also how to manage and prevent the onset of serious and significant conditions. All of us will have anxiety about a particular issue, event, circumstance in our lives, but chronic anxiety or depression are where these states become permanent or episodic. And what we want to do at the Turner, under the leadership of Kim Cornish and the amazing team, is to really help more and more people diagnose or seek that help early, understand the behaviours that can assist them, And we think the next great frontier is the workplace, that a national approach, working with the Business Council, working with the Mental Health Alliance, with so many of the different sources of support within the workplace, and the Australian and state governments, that decade-long approach to mental health in the workplace can provide extra support for people, and that will end up saving lives. We actually had a reduction in suicide in 2020, which is almost inconceivable, and so much of that came from the work of people in supporting others in the workplace. But this, we believe, and I believe, is the next great frontier for Australian mental health support.
You mentioned COVID. Now that you're 20 years after your 20 years in politics, life is now returning to a routine that doesn't involve spending half your life in Canberra. Do you still monitor the news cycle? Have you managed to switch off from every twist and turn when it comes to COVID developments after being so in the weeds for so long? Are you concerned about the surge we seem to be seeing now that the majority of restrictions have been dropped? Do you think the right balance is being struck on that front?
So two things there. Firstly, at a personal level, have I watched Question Time? The honest answer is no. Do I monitor events? Yes, absolutely. That's been, hardwired into my body over more than 2 decades. But primarily stepping back to look at big trends and what are the national challenges, and how can we draw on academia and the private sector, not just in areas such as mental health, but in new business formation, in wealth creation for the nation, in the modern areas such as health, new technology, environment, emissions control and reduction. All of these things will help build the health economically, but also societally for Australia. Then the next thing is, as I look at all of these, I remain optimistic about the country. There are great challenges globally. We see them every day, whether it's in Russia and the Ukraine, whether it's in the Taiwan Straits, and as well as the inflation and economic challenges. But ultimately, my view from COVID is we got through this better than almost any other country in the world. We are an amazing nation, and it's about continuing to harness those capabilities. And this is where, our great academic research institutions come in, such as the Turner and Monash, but there are other great universities as well. And then the private sector, that triangle of research, private sector, and with the government helping to create an environment which is supportive, that's helped us get through, with an incredible community and society, get through COVID. There are legacy issues, no question. The mental health issues are real and significant. The educational attainment issues are real and significant. But of all the countries in the world, I've had ministers from around the world and people from around the world say, gosh, we wish we were in Australia's position.
Greg Hunt, I feel happy for you that you haven't been watching Question Time. I think that's a really good thing after 2 decades in the Parliament. But you might have left politics, but your name does keep cropping up, of course, in political debate from time to time. As we know, Scott Morrison shared the health portfolio with you for some time without the public being aware of his multiple ministry roles. Now the dust has settled a bit on that story. On reflection, do you wish you and Mr Morrison had handled that differently? Do you think the Biosecurity Act does give way too much power to one minister?
Look, I was very focused at the time of setting out clear parameters for use and limits of the biosecurity powers. These were passed unanimously by both houses of the Parliament. Just over half a decade ago, it came that I was the first to possess those powers. And so putting in place the democratic protections was an incredibly important thing. Protocols about consulting with the Cabinet and the states, only acting on medical advice, and we followed those. So the important thing was that we used it on a very limited basis. Prime Minister never exercised any powers, to the best of my knowledge, never sought to exercise any powers, in fact, never even raised that option with me during the course of it. So our approach was always to make sure that we were protecting that democratic fabric, and by putting in place protocols, even when none were required by law, that was about saying these may be extraordinary times, but that's no reason to do anything other than to protect all of the liberties and rights of Australians as significantly as we possibly could.
Greg, do you have any insights for us as to why you were told by Mr Morrison about the double ministry, but other ministers like Matthias Cormann, for example, were left in the dark? And have you had to explain some of this to Virginia Bell, who's now investigating those secret ministries?
Look, in terms of the other elements, that's not something of which I have any knowledge. In terms of the public position, we've shared the same advice with everybody, and that is it was done as a contingency, and the Prime Minister, when he announced the Biosecurity Act, announced that he was the co-holder of those powers under federal health.
So no regrets about how all that has played out since
They're always reviewing, but my focus, honestly, has been on how we continue to take the health of Australians forward, and how we continue to take the mental health of Australians forward. And that's where my mind is at. That's where my focus is at. And when you look back over that period, there are probably two things that stand out. One is that we ended 2020 with as being one of the few countries in the world with what's called a negative excess death rate. So in the great year of the COVID pandemic, fewer people passed in Australia than would have passed under ordinary expectations for 2020. We ended 2021 as having one of the highest, if not the highest, median net personal wealth of any country in the world. So not just average, but median, meaning more people at a higher level than any other country. And so those are two enormous achievements. And when you think in all of the OECD, 38 countries, there was only us and Japan when we left office with a vaccination rate above 80% whole of population, a death rate below 300 per million, and an unemployment rate of 4% or lower. And we're one of only two countries in the world in the OECD to have achieved that. And that's the measure of, as a country, what we've achieved. Always, every day, you look to do better in every element of life, whether it's governance, media, private sector, academia, sport, family life. Always you're looking. But as a nation, I think we should be immensely proud of what we achieved. And I just want to take this opportunity to thank the medical profession and all of those involved in the public health response, as well as the Australian public. We couldn't have done it without it. Other countries had great fractures. The thing that really marked Australia out was the outcomes, but also the fact that we held together as a nation. And that says there's something pretty good about this country.
Greg, I can understand you don't want to dwell on the secret ministries issue, and to be fair, that's not what I asked you on to talk about today, but I do just want to pick up on my earlier question, which was, have you been interviewed by Virginia Bell and her team, and what are you expecting her to find at the end of her inquiry?
I'll leave the responses. We said at the time when we were asked about a month ago that we'd respond, which we did, and dealt with that exactly in the terms. In fact, I was thanked by Virginia Bell for both the timeliness and the comprehensiveness of the response.
Okay, one last question for you, Greg, because I'm sure you've got plenty to get on with today. But one other thing I did want to know, your final address to the Parliament, you spoke a lot about your children, James and Poppy. The plan was to give them a lot more dad time that they'd missed out on. How's it going? Are you enjoying being able to do the school run? The backdrop behind you now is a lot more pleasant than the blue room at Parliament House.
Yeah, no, look, I enjoy that. And, being around more is good. You never get everything right, as per your previous questions. But my young guy has really taken up going to the gym and being able to do that with him. He's 13, but just magnificently fit. I'm really, proud of him. And then my daughter is in the midst of her VCE exams, one down, which I think, it looks as if she's come out of that very happy, one to go. And although it's a stressful time, I'm equally proud of Poppy and her work. And above all else, I'm blessed with Paula, my wife, who has really taken the responsibility for so much of the parenting over the last 17 years since Poppy came into the world, and it's just nice to be able to do my little bit. And over the years, my one regret is not having had more time for them, but that's just sadly the price that comes with those public roles. And it's not me, it's pretty much everybody in those public roles. And so I think it's important to acknowledge what those in public life now sacrifice, that they do make that sacrifice. But I'm home and enjoying it, and looking forward to going for a walk with my wife this afternoon, and maybe to the gym again with James.
Greg Hunt, best of luck to Poppy for the exams, and best of luck to you with all of your post-political endeavours. Really appreciate you taking the time to speak with us. Thank you.